Dr. Haynes presenting. We are doing this as part of the Geriatric Psychiatry series. A little bit about Dr. Haynes. She came to us from Tennessee. She got a bachelor's degree in psychology and minored in dancing. Graduated with one of those fancy Latin phrases, summa cum laude. She then took the dancing to the next level, went out to the University of Hawaii, where she got a master's in fine arts, and launched her career in dancing, which she did for over a decade before coming back into the fold and studying medicine. She got her MD out at EVMS in Norfolk, and then did her residency here in psychiatry at UNM, and is now a Geriatric Psychiatry Fellow. Through all that, she has maintained her keen interest in education, has had multiple projects here at UNM under the mentorship of Dr. Geppert, Dr. Smart, and currently Dr. Abbott. Today, she's going to talk a little bit about the Kern's 6-step curriculum design and how she used that to design ECT education. So without further ado, it is my pleasure and my pride to introduce Dr. Haynes.
Thank you. Thank you so much, Dr. Miller. I am really super duper excited to be here today and talk to you about stuff that I love to nerd out about, educational scholarship. So get ready. Okay, Jeremy, do you see just the slides? Perfect. All right, everybody. So today we're going to talk a little bit about educational scholarship, mentorship. We're going to think about Kern's and talk through one project where we applied the Kern's 6-step model and are in the process of that. We were going to talk about straight geriatric psychiatry, but then I decided to change the topic. So we're going to talk about ECT, which is still in the realm. I know all you Geri Psych buffs are a little bummed, but here you go. So who did this project? That's me and my 2 kids out on a snow hike. We are loving New Mexico. And so that's the first. I was kind of the original seed for the project I'm going to talk about today. And then we also have Peyton Widener and Tessa Olmsted, who are PGY1 and PGY2 residents respectively, that joined onto the project because of their interest in geriatric psychiatry and neuromodulation. And then we have the experts here, Dr. Miller and Dr. Christopher Abbott, who provided a lot of the content expertise and other wonderful resources and supports. I will note that Dr. Abbott gets a shout out for true introversion, giving me a picture that's mainly his dog in the frame, but you know, it takes all types. So here we have the objectives. Today, we're going to talk about identifying elements of the Kern's model, describing one specific class developed within the Kern's model, and discussing how creating classes can promote growth with people as academic physicians through mentorship, education, and scholarship. So when you think about academic medicine, perhaps you think about the 3 core components, thinking about clinical.
Hey, Dr. Haynes, I'm gonna stop you there for a second. I think there's something off with the slides. Yeah, Dr. Hensley, are you noticing that? I think it looks scrambled. Yes.
Okay, I'll take it off presenter view. We'll try a different way. Thank you for letting me know. Let's try this.
And if you don't mind, if we get it working, yeah, I would like to see Dr. Abbott's dog. So if you wouldn't mind, go back.
You want to see his dog?
Yes.
Oh my God, I'm so sorry you didn't get to see the dog. What about now? Are you seeing him better?
I see the first photo. Oh yeah. If you bring him up.
Yeah, in the slides, the written ones looked better.
There it is. Oh yeah, Dr. Abbott hiding behind his dog. Well played.
Okay. We're there now? Looking okay?
Yeah, it's better.
Great.
Yeah,
thanks.
good.
All righty. Back into it. Okay. So when we think about academic medicine, you might think about the three core pillars of clinical care, research, and education. But I found this article from Laura Roberts, one of our very own here, where she talks about expanding the conception of academic medicine to include collaboration with communities and also this commitment to equity, professionalism, and ethics. And I think that's really core to who we are, not just as a community, but also who we are here in New Mexico and some of the missions that we had. So I wanted to share that article with you on the bottom right. But let's specifically talk about education for a second. Within that realm of education, we have these 5 different elements that everyone here participates in to one extreme to another: learner assessment, curricular development, mentorship and advising, educational leadership and administration, and teaching activities. So the project we're going to talk about today really talks mainly about teaching activities and mentorship, a little bit of curriculum development if we think about how this is the class. This class was created to start a new kind of evolution in the ECT or neuromodulation curriculum that we're offering here at UNM. And so all of these components don't become medical education scholarship unless we share them widely and put them out for peer review. And we'll talk a little bit more about that process at the end. So this statement, I create effective and engaging educational experiences. It's my affirmation for me as a teacher. When I think about who I want to be and how I want to present myself to learners and the types of experiences that I want to engage in with learners, these are things that are really important to me. And so sometimes the process of making education or providing educational experiences can feel kind of maybe overly complicated. Maybe there's not a clear direction, and I might not have enough resources, as in knowledge or time, to accomplish what I really want to accomplish. Maybe even the idea of jumping from just what I'm doing here and putting it out there on a larger spectrum is a little overwhelming. So what we're going to try to do today is pare this down. We're going to Robert Frost it a little bit. We're going to think about which path, how can we make more of a pathway to what would be a clear path to doing this type of research and this type of scholarship. And so if we go back into this idea of dancing, for me, dancing means what's the meaning? Why do I care? Why am I engaging in this? What really drives me to be an educator or a teacher? And so part of that is you have to do some kind of self-reflection and thought on that. Maybe as an academic psychiatrist or physician or an academic, you have made a teaching statement. You've had to actually pull your thoughts together and make a real intentional kind of statement about who you are, what your values are, and how you reach them. If you haven't done that, I encourage you to think about doing it because it provides target. It provides a direction for the kinds of classes that you want to make. And as we all know, setting an intention or having a goal really clarifies the steps and helps us prioritize what's important. So if we also think about teaching, a lot of the times we do it by rote instead of really doing it in a thoughtful and kind of precise fashion. But like many of the things that we do as scholars, there's a framework, there's a reason why, there's other scholarly work that's been done that we stand upon, that we build forward into our field. And so these conceptual frameworks, they really represent how complex things work. And so we have to also think about not just what the diagnosis is or what the current scientific theory is about whatever. We have to think, what is the concept? What is the theory about learning? Now, you and I don't eat the same tacos, most of you. I like to talk about geriatric psychiatry. I like to teach about that. Perhaps you like to teach about child or addictions or psychotherapy, CBT, psychodynamic, whatever your taco is, it's really immaterial. I am going to discuss this process with my favorite taco, geriatric psychiatry and ECT, but this can apply to all different content areas. And so I ask you, how are you teaching? Take a moment. I will sip my tea. So maybe when I said, how are you teaching? Many, many things came to your mind. Maybe nothing came to your mind. Or maybe the words, like I always do. And so let's talk about just a couple of learning theories, which provides a conceptual framework for how maybe the teaching is happening. So right here, we have this beautiful fat baby on a computer. Really, the computer is the important part. If we think about great centers of learning, and when the tradition of Western kind of educational centers and higher academic centers of learning happened, it was people that had access to the knowledge, to the books, would go and stand in the front of a classroom and talk to a group of people who would then listen and write things down. It wasn't very interactive or engaging. Those types of strict transmissionist lectures, they still exist today. And kind of the conceptual underpinning is I tell and you listen and then you know. Or in a more modern parlance, I write in a program and then the computer knows and does. Another learning theory, maybe you're a constructivist like Piaget, and you think everyone has internal structures of knowledge. And then as the educator, it's my job to understand what you already know and then help you fill conceptual gaps or modify your current structure to accommodate new knowledge. Maybe you're more into andragogy, like Malcolm Knowles, and you're thinking, it's really about what the worker does. It's about what the person, the adult learner, needs to know. Is it relevant? Is it timely? Does it apply to what the skills and behaviors and knowledge that they need right there? So these are lots of different types of theories. None of these are the ones that we're going to go through today. Instead, here's a little link, if you're interested, to a story or like an article about conceptual frameworks and how they can underpin academic scholastic projects. The theory that I'm going to talk about is the affective context theory of learning. And so I think many of you here today would agree with me that stories are very important and that the emotions provide the necessary kind of dynamic tone, the motivation, the reason why that emotions are important. And this theory, the affective context learning theory, proposes that people learn because they care about a topic and they learn through storytelling. And so it behooves us to create educational experiences predicated on storytelling and emotional context. This QR code takes you to the book on Amazon if you want to read more about it. So going back again to these creating impactful learning experiences where we think about not only transmitting information, but also shifting attitudes and building skills at the same time. So again, I know I'm belaboring this point right now, but learning is not knowledge transfer. We all have phones. We can go to UpToDate. We can do the searches to figure out what the correct dosage is to start that medication. We can figure that out. True learning is kind of changing someone's behavior or their capability as a result of a memory. And those memories are created because of an experience that we care about. It's emotionally loaded and it is able to be constructed because of the feelings. So if we believe that, then we have to care about a learner's concerns. If they don't care about what we're teaching, it is very unlikely that it's going to stick with them and that they'll be able to change their behavior or their capability. So if we develop educational experiences that are directed towards engaging, caring, or moving emotions, then it's much more likely that they're going to have a lasting impact. And this little book is just telling us that it's all about story. We exist in a practice, in a field where we listen to stories. Our notes are infamous for being story laden, right? We're thinking about what that person is, what they've been through, where they are now, and where they need to go. And so it's quite easy to use those case examples to kind of help build and drive the educational experiences. And that is what the affective context model has taught me to really emphasize within the classes that I make. That's one of the ways it's changed the educational content that I create. So let's go back to that core question. How? How am I creating these effective and engaging educational experiences? Or am I, right? So it takes a plan. It can be really fun just to show up the day of the show like Miss Piggy and just like be outrageously fabulous. But unfortunately, that's not the way quality content is made. You much more have to be a Kermit the Frog, the person that's making the list, checking it twice, making sure that we have all of the performers there, the lighting guys there, the back of house, the front of house. How are we going to run the show unless all of those things are done? So I'm going to share with you here 2 other resources. This first one is the on the left side of the screen is the outline of steps that I took to create this class within this scholarly model. I share it with you, not to make you overwhelmed, but to give you like a real nuts and bolts. This is one way that one person in my community has engaged in this process. As a little bit like look behind the curtain. And then on the right of the screen, you can see a resource that you can grab from the Master Educator program. So the Association of Academic Psychiatrists puts on a bi-yearly class that covers many topics in academic medicine, evaluation, curriculum development, assessment, different things. I've had the opportunity to go 2 years in a row. It's been super useful and informative. And this is one of their handouts that they gave during one of the classes that I went to that helps people start to formulate the idea of what their educational product will be and really think about some crucial questions to push it to the next level. So I share these with you as resources in case you're interested. So going back again to the learner, on the right side of our page, we see an older gentleman with a young kid, and he is pushing her and she is pulling herself forward, right? And so thinking about this push and this pull duality within the learning environment, we want to think about what the learner needs, right? And are we responding to the concerns that that learner has, or are we trying to create new concerns? So if you're at the end of a PES shift, your concerns are both the patients that you have under your care, but also like, when am I going to get to sleep? And when is the next time I get to eat something, right? At the beginning of a shift, your concerns, maybe the tipping balance is somewhere else. Yeah. And so when we're thinking about designing educational products, we have to consider, like, what does the learner want to learn about? Now, this may shock you, but not everyone wants to know about geriatric psychiatry. It shocks me, indeed. So sometimes I have to consider, how do I inspire people to care more, to be more concerned about the patient population that I'm like all about serving, right? So I'm going to design experiences to help them develop more care, to engage their emotions, and to tell stories that help engage their emotions. Now, there may be a small or a large subsection of you that really care about geriatric psychiatry and just like already know a lot about it and are very driven to learn more on their own. For those learners, I'm going to provide more resources because they're already into it and they just need more support to push forward in their learning. So let's be a little meta for a second, right? Look in the mirror. Notice what I've been doing at the beginning of this presentation. Not only have I been telling you about what I'm doing, but I've been providing resources so that people that have more interest in maybe academic medical scholarship will use some of these resources to learn more. They will pull themselves forward, like this little girl on the right, into more knowledge. Some of you may not care at all, have very little concern about it, which is also good. Yeah, no judgment. But you have to think, like, where is my learner? How am I creating resources and experiences to meet them where they are? So let's think about the Kern's model for a second. This is a widely utilized model in scholarly design. Many of the products have a discussion about using this model as you go through developing curriculum or classes for medical education. And we are going to talk about this in detail today. This is the book. There's a little QR code there on the left. You can grab it up to the Amazon link. It's quite a lengthy book, but what you're going to get by going through this model is a roadmap. Okay, this is a validated system and a way to kind of understand the development of a class and a way to talk about it in a scholarly fashion that other people are familiar with within this practice. Now, if you don't have time to read a whole book, you might want to grab this QR code here in the middle. And this is a PDF from another Master Educators class that I was at. That's just 2 pages and gives a very quick overview. So we have this little justice symbol. Do I think that the Kerns is the best approach? I think that it's the most widely utilized and most understood by many people within this practice. I think there are some problems with it, but that's outside the purview of the talk today. I just didn't want to let this slide go by with you thinking that I thought it was the bee's knees pinnacle of educational curricular design, but I do think that it is a very good starting point. Okay, so here we go. This is the Kern 6-step approach. This is a graphic of it. Pretty busy, but what I wanted to show you on this one is if you'll notice the graphic in the middle, it's not a particular cycle. These arrows don't just go around the circle and keep circling in the same fashion, right? There's lots of intermediary arrows and back and forth arrows. Looks kind of like a solubility equation. So when you think about this process, understand that it is flexible. We might start going around, right? But at times you're going to have to like jump back to other ideas and then maybe jump forward. So it's pretty fluid. So here we go, a little bit of a more streamlined graphic of it. We're going to start with the problem identification and general needs assessment. So how does one start with that? Number one, you have to identify the problem or the challenge. So when turning our focus to this ECT class that we created, Dr. Abbott and I were talking about this, about a fellowship I wanted to apply for to really learn how to create a class and propose it for the MedEd portal. And we were spitballing about challenges that he experienced in his clinical care and came up with the idea that we needed to improve the quality of referrals and the diversity of patients who access ECT. And so that became kind of the original idea of how to create or what to create the class around. The second element was figuring out, what are we doing now? Dr. Abbott was teaching some classes here and there when asked to different health professions, residents, nurse practitioners, other advanced practice providers within behavioral health to discuss the process of identifying the appropriate candidate and referring them, which was kind of which was not the ideal approach. The ideal approach we decided would be to create a class that was specifically targeted at this, at these kind of topics, and then to deliver it more widely, and then to see if we could disseminate it with this process of medical scholarship to the population at large. And so this, you can see in the middle, this creates our general needs assessment. This is a slide from our actual class that is about a bit of scholarship we found, studies showing that there's a disproportionate of female, older, and white patients that receive ECT, and that there are some specific barriers that could be because of elements of stigma or bias, such as restrictive laws, less actual facilities that offer ECT, kind of the classification of the machine. And so this gave a little bit of evidence, a little bit of support to this idea that we need to target not just quality of referral, but also diversity of patient. And how do we do that? By addressing stigma. So then we asked the question, do the educational resources that we have right now teach about this? So Tessa did a lit review of current ECT education, open source kind of content, and also like what's provided out there by some of the national and international organizations. Answer is not much. There's not much out there that is in the current public milieu about ECT education. And then Peyton did a lit review about stigma and bias surrounding the procedure of ECT. And he found many, many resources discussing that. So that kind of supported the idea that, yes, this is something we should teach about. And then we took a look at our own curriculum. And indeed, there were no current classes that were addressing this in the psych residency program. So seems like we have identified a gap. And then we created this class, ECT referral for depression, assessing patients and addressing stigma. Here on the right, you'll find our slide deck. If you want to take a look at that, maybe you love to multitask and want to click through the slides from the actual class while we're talking about it. Feel free, or you can grab this for later if you want to look at slides at another time. So we have identified the problem and done the general needs assessment. So what about our learners in particular? What do they want? And so again, let's go back to our overarching framework. You can't design effective resources or experiences unless you know the people that you're designing them for. So do our learners even perceive a need for this type of education? So we asked them, and here are some ways that you can perform a targeted needs assessment. Maybe you give them a test. Do the learners already have the capability or understanding? You can do focus groups. We can do formal interviews. What we ended up doing was a questionnaire that was given to the residents. And they were invited either in person during a class or through email to complete the needs assessment. You can see that PGY2 won the game as far as the most respondents that responded to our survey. And here you can see the like the metrics of what we asked them, like how much learning, how much need do you perceive, little to very high. And so on our first kind of question, and these objectives changed a little bit, talk about that later. Do the students perceive a need for learning about assessing a patient for ECT referral? Well, yeah, most responded either high or very high. What about describing societal stigma towards ECT? This was kind of more moderate to high. Discussing ECT as a therapeutic option, it was high to very high for the most part. And then discussing risk benefits and therapeutic course, again, very high or high need. So we can say, yes, we did the work for a targeted needs assessment, and our learners, the ones that responded, for the most part, were reporting a need for this type of learning. So that gave us the kind of support to say, yes, not only is there a gap in the current resources, the public literature about classes around ECT referral, but our learners in particular, they want more. So let's talk now about goals and specific objectives. So I could go on for ages about SMART goals. We don't have time, and you likely don't have the interest, but I think goals are super awesome because they give us a target. They tell us what we're striving to do within a class, and they personally help me pare down all my large aspirations into a more manageable sandwich to eat during lunch. And if you think about Bloom's taxonomy, this may be a new thing. I know it's not for the residents, except for PGY1. You guys haven't had my class yet. But understanding Bloom's taxonomy, it creates a hierarchy of educational complexity or learning complexity. So it is necessary when you're creating your learning objectives to really think about how complicated you're making the tasks for the learners in the class you're designing. And then you want to think about, for these objectives, what am I actually trying to build within my learner? Do I want them to gain knowledge? Do I want them to shift attitude? Do I want them to have a new skill or exhibit a new behavior at the end of this class? And again, let's bring it back to our conceptual model. So we have our affective context model here, and it is proposing that it is not enough solely to build knowledge, but you have to provide time for students to reflect and to like kind of understand it on a more emotional basis so that they can build new capability. So thinking about those things as you design your goal gives you a target. What am I really focusing on in this class? Because you guys, sometimes I just love more is more, and then more is too much, and I don't get through everything that I decided I wanted to do. And that is really an unsatisfying situation for both the learner and the teacher. Now, we refined our objectives for this class no less than 5 times. And I'm not just talking about like little edits. I'm talking about big edits. Like, what do we actually want to be teaching here? So this is an iterative process when you're thinking about creating a class. It's not just a one and done for the most part. So here are the objectives we ended up creating for the class. I'll give you a moment to read them. I'm not going to read at you. Again, I have my blooms here on the right. I have so many blooms graphics. I love them to death. But again, thinking about our pyramid, at the bottom, we have remember. Remember is like when you do talk back with your patients. Tell me what the plan is before you leave. They're just listing a series of ideas or expectations, all the way up to create, or evaluate. This is when your advanced student, maybe in the psychiatric emergency services, is coming to you and formulating the plan. They've assessed the patient, they've done the diagnosis, they've thought about what is realistic for the patient and the resources there, and then they're presenting to you how they're going to go forward. So each of these levels becomes a little bit more complicated for the learner. So when you think of your objectives, you're telling them by the end of this class, learners should be able to do the following things. And you can, if you're interested, with your objectives, go back and put a number as assessed by Bloom's taxonomy to the right. And then notice, do I have all of my objectives be a level 5 or 6? If that's the case, that is very complicated in what you're asking learners to do. Maybe all of your Bloom's objectives end up being like a 3. Maybe your class isn't complicated enough and you need to push or stretch a little bit more. This is kind of an interesting check you can do just to look at the complexity of what you're attempting to do within a class. And remember, this is your compass. This is your guide. When you're creating the class, come back to the objectives and say, you know, I really love this idea of doing whatever fantastic experience it is, but I think it'll take too much time and it's not really in line with the objectives. Then you have to cut that out. You have to be a judicious editor when you're creating a class. Okay. So we have created some objectives now. The next thing we're going to do is think about educational strategies. And this is the what I'm actually doing. Going back to me, I love things to be engaging and effective at the same time. I don't want to be bored as a learner or as an educator. On the left of your screen now, you will see a list of different types of educational strategies or methods that you can use. Let you read that. And we're going to go through some slides that I'll show specific educational methods that we used in creating this class. Again, with the affective context model or theory of learning, I'm not just going to sit here and talk at you the whole time as a lecture. That's not engaging. That's going to not engage people's cares or make them manipulate the material or really get drawn into a story and have that affective component. So likely most of my classes are going to include 1 or 2 of these active engagement techniques. Now, I love this gentleman. He looks so bored. We have all taught a class to people who are not engaged, or maybe we as the educator, we're not really engaged or invested in the experience. And so it's really relevant when you're thinking about these educational methods to use a little bit of variety. You know, that's the spice of life. Just sitting around and having someone talk at you for like minutes at a time can be pretty boring. And at this point, I want to acknowledge my own hypocrisy because I have been talking at you for at least 30 minutes now, and I appreciate that you're still here, even though we haven't been engaging your mind in different ways. I did try to think about other ways to make this interactive as a grand rounds, but I decided to be cognizant of the pattern of our current grand rounds. If we ever go back to in person, I'd love to do a workshop one. I got some ideas. So moving on, this is a slide that is in the class that is about a lecture format. So you'll notice on this slide, we have a topic sentence and then supportive pictures underneath. This is a slide that's built in the assertion evidence model, and it doesn't have a huge block of writing on it. And the thing with that is when you're giving a lecture, you actually don't want people to be trying to listen to you and listening to their own internal voice as they read. So it's really important to kind of think about that duality while you're presenting. You might also have a slide like this in your lecture where you're inviting the audience to reflect on their own experience and share it with others. This provides an opportunity for reflection and discussion, a more active engagement model, and gives an opportunity for students to make their own meaning, which is in keeping with our model. You might have a slide like this in your lecture, which is a case. And so students can read this to themselves, or they can read it aloud, and they're hearing a story. And this is also designed in our classic case presentation, like case vignette model that many of us that have been through medical school are very familiar with. And then on the bottom, you can see there's discussion questions, kind of asking them to assess this presentation and make a decision, and then they can talk about it in small groups or in a large group. And this educational method is the case-based learning. Then finally, we have this slide, which the students can take a picture of this QR code, and then they're able to read on their own phone or computer. And it's actually a role play scenario where they get to talk with each other and kind of explore what's happening within the dynamic between the provider and the patient, and then answer questions together before they come back to large group. And so this education method is role play and near peer discussion. Also very good because it has the storytelling for our overall context, and is about like kind of when you're thinking about like the attention of a group, if you always have it in large, then they can get kind of exhausted. But when you shift focus to kind of talk, pair, share, or personal reflection, it helps keep engagement active. And this final slide I'll show you from the course is all resources for patients and families. So we've provided the student with the opportunity for further reading within the slides to investigate these topics more if they're in a poll method. And it also is a thing they can share with a resource for their patients later on. So we're providing them some support for their clinical care. Okay, so we've gotten all the way through educational strategies and we're on to implementation. Is there something in the chat I should be aware of? So in implementation, you think maybe it's just like Miss Piggy shows up and dances, right? Get there, I'm just going to go into the classroom and talk about my expertise. I'm just going to be fabulous. But as we talked earlier, it takes a lot more Kermit the Frog planning, a lot more order muppeting to be able to get to the point to have a very well thought out and structured and prepared class. So some of the things that you might need to do during this implementation step come a little bit earlier in the process. Maybe you need to obtain political support. Like Kermit's going to call some people, make sure that the administrators want to support this class within the curriculum, or the people that you're working with think this is actually a good idea. Maybe you're going to have to get some more resources. Like, do I have time to dedicate to creating this class right now? Do I have the money I need to pay REDCap for the survey instrument, etc.? Do I have the right team of people, of expertise, and other people that want to learn about this to kind of contribute to the process? And then maybe there are some barriers. Maybe you're like Kermit and you need to curl up with a towel when you think about going through an IRB process. But I tell you, learners, it is possible. And if you're interested, I can tell you more about it, especially for an educational project. It's quite an abbreviated process. But there are true barriers in learning how to navigate that system. And then at the end, everyone has a party, or I mean, we all come together and we teach the class, and we get to kind of show all of the work that we've done and evaluate how did it go? Like, were the things that I wanted to teach well received? Is the content useful to the learner? And kind of see how well I've executed this plan. Did the way that I went through creating this class, was it useful? Was it efficacious? Was it relatively pain-free for me and all of the people on the team? So we've gone through implementation now, and we're at feedback and evaluation. This is the step where we figure out like what we actually know. How did it go? Is it working? So we go back and we think about our earlier objective domains, but now we're thinking about them in the terms of evaluation. What do the residents or the learners now know? Have any attitudes shifted? What skills or behaviors have been built? So this is Kirkpatrick's pyramid of evaluation. It is a very widely accepted tool to think about evaluating educational projects. Here on the top right, if you're interested, this is the QR code to our actual evaluation instruments. I patterned our evaluation instrument after one that was given to me through this medical writing fellowship that has been, and kind of pulled it from other things off MedEd portal. So this is a good template if someone wants to use to start thinking about how they make an evaluation instrument. And so for this class, we really only looked at the first two levels. The first level of Kirkpatrick's method is about reaction. It's about the learner's attitudes or change in confidence, their self-assessment of capability. Level 2 is learning. So we're going to actually assess if you gained knowledge or skill by measuring that in some way. So for our purposes, we asked students about their change in confidence with the class objectives. That was level 1. Level 2, we asked them some knowledge questions, multiple choice questions. Level 3, if we wanted to do that, we could actually see, does behavior change? We could measure how many more referrals that we got that were appropriate or of a certain level of quality from residents. And if we wanted to look at results, we may do something like evaluate the diversity of our patient population that is actually receiving ECT. Has that changed? Has it become more diverse as a result of or subsequent to receiving this class? So those are other levels that you could do that when you're creating a project like this. We ended up using REDCap so that we could de-identify for IRB and also so that we can match pre and post discrete entities for different statistical evaluation. So what did we find? Learner assessed that their confidence in their ability to perform the learning objectives increased. You can see here on the graphs that Dr. Abbott made for me about the pre-post surveys. These are all resident self-assessment. The trend line is going up. There is confidence that's being built. You can see these individual lines on the graphs. They represent, unique, discrete people that are having a pre and post like assessment of their confidence. Oh, and this is our scale. Excuse me, no confidence to completely confidence. Completely confident was 4. And again, this is the reaction level that we're seeing here as far as the data. Qualitative feedback indicated that learners valued the interactivity, they liked the case-based learning, and they liked the engagement and expertise that was brought into the classroom. You wanted to read some of these here, but you kind of can use this qualitative moment to say, like, what more can I capture outside of these more Likert scale kind of assessments of capability? And then some reforming feedback we received was ran out of time, very accurate, everyone. So we've decided to try to expand the amount of time to teach this class. We want more candy and better electronics, maybe some more details. But those were the main things that we captured from the qualitative. And so this is where the work begins. Now I'm going to go back and take all of these kind of recommendations and see which ones do I think are valid, which ones I think that are valid and I can change, and then go back into the class. So we've gone all the way through Kearns, around the circle. And so what happens next? As I said, then we iterate. We're going to take the evaluations, the feedback that we got, and try to improve the class. And I will teach it several more times around our community to get more learners to evaluate it. And then it continues to grow. Every time we do it and we go back and we refine it, the class gets better and better until it's this beautiful picture. And then we think about what comes next. Are we still dancing here? Were we happy to stay on step 1 with this class? Or do we think, is this the seed, the beginning of a larger kind of curricular arc? And where else can we go with continuing to develop quality educational products for ECT that can be open to the entire community? So thinking about that, the entire community, this scholarly work, it has to be public. It has to be available for peer review, and it has to be reproducible. And so that is what really transitions a quality educational product from something that you just give and enjoy in your own home community to something that's shared across the community of educational scholars and really contributes to that body of knowledge. And so we go back to the 5 kind of elements of education and academic medicine. And we think, why is the reason to do this? Why would we go through all these steps? Wayles, it sounds like a whole lot of work that you did, and now you're going to get to write it up. Well, it really is to say, you know, this is something that's worthwhile. We need to dedicate resources and energy and make better classes and improve the educational experience, not just for us, but for our patients. You can see how a project like this kind of interacts with improving clinical care as well as improving educational. And the other thing is the mentorship. You know, Tessa, Peyton, Dr. Abbott, and Dr. Miller and I got to spend some time knowing each other and learning things about ECT and medical education scholarship and teaching each other. And that just strengthens our community. And so this is just one way that a project like this can be done. Maybe your jam is mentorship like it is for Dr. Smart, or I'm sure there are many other people out there that I haven't gotten to know well enough yet that have exciting interest in some of these other topics that could really kind of jump on this and create, improve the educational experiences for us in our home community and also spread them across the community at large. Now, here on the left is an article you might want to grab if you're interested in just understanding more about what medical education scholarship is. Like maybe you need to read a little bit more to really define it for yourself. And then on the right, here's an article that actually gives a little bit more of a primer about how you develop these education projects. And so I recommend both of these. The one on the left is like a 2-page short read, all residents could be able to do this if they have interest. And on the right, it's a little thicker. So if you're really more into the nitty gritty. And then the MedEd portal is where we will be presenting and like submitting this for publishing. That's a whole big process. If you are interested in that process, please reach out to me. I would love to talk with you about it. And so here are some more resources for you. On the far left, this is a QR code that will take you to our CPL medical education scholars. I know some of the faculty have been through this program or are going through it now, and it is a more rigorous program offered here at UNM that teaches people about medical education scholarship. And then on the far right is a link to the residents as educators. And I know psychiatry is usually well represented in this every year. And I think that I encourage all residents to think about applying to the, this is a 2-day workshop that's provided here for UNM residents, and you can use your education days for it. And then in the middle, you have the Association for Academic Psychiatrists. And this is the national organization of people that like get lit about education like I do. It's a really fun conference. And they also have this medical education master educator program that you can go to. It's not too expensive. I encourage everyone to think about going. It can get you really excited and give you a lot of good information. And then again, here's my email, or you can Tiger Connect me. I'd love to have coffee with anyone that has an educational interest or project that they just want to workshop. I think we need a little more energy and excitement about this to, you know, lift everybody up and make education better overall. Thanks, everybody.
Thank you, Dr. Haynes. We have a few more minutes if anyone has any questions. Open it up.
Great presentation, Dr. Haynes. Thank you. I'm wondering, you know, technically we all came to the School of Medicine because teaching is important to us. I'm just wondering if you have any thoughts about how and what might be obstacles to individuals retaining their passion for education.
I think it would be easier for me to name reasons that you wouldn't have obstacles than the obstacles, because they can be so overwhelming. You know, like we don't have enough support to know what we don't know. And it is daunting to be burnt out clinically and to still find your passion for sharing what got you into it originally. One of the reasons that I do that I'm trying to get nerdy with it is to keep pushing myself in this fashion. It's very easy for me to be Miss Piggy and just wear some fun eyeshadow and like talk about stuff I love. Yeah, like, but if we really want to, if I want to like make this a core part of my academic like identity, then this is the type of work that needs to be developed. But I think that there's so many reasons not to do it. And this presentation in any way was designed to be motivational and like provide opportunities instead of like this thing, because there's so many resources out there. We don't know about them, and maybe it's not the right time. And if it's not the right time for you, that's perfect. It may be the right time later to pick up one of these resources and think about the hows versus just getting through the doing it.
Thank you.
For sure.
I would like to jump in and say thank you. It's really made me think about my own teaching, and these are things we should be talking about. I've never heard of the Kern's model or many of these theories, and so it really makes me contemplate how we were trained and how many of us are changing and delivering training modules in very different ways now, but really to think about even further making changes to make more sense with adult learning in more meaningful ways. So nice job. Thanks.
Thanks, Dr. Kane. I will say I had to seek this out, right? This was not something that was readily available within what I would say most residents have access to. So that's why one of the reasons I wanted to share it, and also all of these resources. So if someone was curious, here's a way to get started on the path.
I do have a question. When you are using this model, do you let your students know about your preferred pedagogy? Is that something that you talk to them about like you've done? Okay, cool. That's exciting to hear, because oftentimes students don't know what they're getting or why. So I think it's a good opportunity to start that conversation from the get-go.
I try to be pretty meta in my teaching. Like, this is why we're going over these objectives, and like maybe redundantly repetitive sometimes. Hopefully not to the point of like insult, but also like, hey, notice this, like, notice this is what we're doing. Because I do believe that we are teaching teachers here. We are teaching people who are teaching people who might teach people their entire life. And so the more obvious we can be, I think the more supportive we can be at pointing out like what we're doing. And then we have like a kind of a more thoughtful practice, and that might keep people engaged in it.
I want to thank you all for coming. And again, Dr. Haynes, thank you for presenting. That was fantastic. Have a good weekend.
Thanks, everybody.
Thanks all.